I now give the floor to the distinguished representative of Sierra Leone.
Thank you, Mr. President. Mr. President, the collective message we've heard today from Dr. Nabarro, SRSG Bamburi, and Madam Malcora is that we need to acknowledge the progress that has been made, but there is no room for complacency. We need to be adaptable, we need to be able to evolve, and we need to be able to anticipate the needs that will come down the line to make sure that we get ahead of this Ebola virus. The news from Sierra Leone remains grim. The daily total of new cases remains depressingly high, and I think in the past few days it's got into the hundreds. There are tensions concerning payments to medical workers, and there have been reports of strikes for medical workers not getting monies promised to them or because of the slow dispersal rate. The world attention needs to be focused to this situation because it is without precedent and it threatens all of us. We are grateful for the efforts being made through the various interlocutors on the ground and also here at headquarters to keep the three most affected states fully informed. We acknowledge the efforts of the Ebola Liaison Center, Madam Alcora, SRSG Bamburi, and Dr. Nabarro. This morning at 7:45, we met as the advisory committee of the Multi-Partner Trust Fund, and the collective view was that we should do our best to make sure that funds received should go to worthwhile projects as soon as possible. We also agreed, amongst other things, that the strategic objectives should be met in terms of the response, and that we should make sure that the projects fully confer with these strategic objectives. Mr. President, the situation remains grim, and yes, we do have pockets of good news to report, but we still need to see, there's still a need for greater collaboration, cooperation, and a deeper impact in the provinces, prefectures, and counties outside Monrovia, Conakry, and Sierra Leone. The message we received, particularly for Sierra Leone, is that there are outlying areas where the message has not got through yet because of a lack of communications, because of a lack of simple tools such as radios, and therefore burials continue to happen in an unsafe way. As we know, the goal is for 70, 70, 60, whereby 70% of the cases are captured in treatment, 70% of safe burials are also achieved within, I believe, by December the 1st. SRSG Bamburi has given us some figures for that suggest room for optimism, but as I say, we're a long way from having much to celebrate. In Sierra Leone, we lost another doctor, one of the key responders on the front line, and this loss continues to demoralize our medical staff and our medical personnel. Before Ebola, the public health system was truly challenged in Sierra Leone, and in this Ebola phase, it is now under its most critical challenge to date. Post-Ebola, as my colleague, the distinguished ambassador of Guinea has said, we need to continue, or reinvigorate our efforts concerning the humanitarian, the economic, and other consequences that threaten the gains we've made coming out of collective conflicts. We're grateful for the attention that the Peace Building Commission has also focused on this attention, and we were grateful, Mr. President, for your efforts and the efforts of the Security Council focusing attention on these efforts. To date, we are cautiously gratified by the deployment and the establishment of UNMIR. We hope that the staffing levels will soon be met and that the deployment, the establishment of resources to the place where they're most critically needed will be achieved. Mr. President, the test is simply this. We will know when we are ahead, when the beds and the treatment resources overtake the rate of infection. We will know when we're truly ahead, when the most isolated populations in villages far away from the capitals hear the news and change their behaviors and conduct accordingly. We repeat the message that for all teams, all nations who have responded with medical health teams, to please collaborate fully with MSF and also UNMIR, who are on the ground, and also the National Emergency Response Center, to make sure that they apply their talents, their resources, and their efforts to the specific areas where they're best needed. We're grateful for the continued level of support in terms of resources that have been focused on this. Most recently, we're grateful for the promise and the delivery of support from Japan and India and other states. We also appreciate the high-level visits that have been made to the region, most recently by Ambassador Power and also by the UK Secretary, the Right Honourable Philip Hammond. Attention needs to be focused, but we also know that speed is also a key critical factor. It is no good for us to have the resources sitting in warehouses, but if they do not get to the front line and help the doctors and nurses who, day by day, risk paying the ultimate sacrifice. We've also agreed collectively among the 3 ambassadors of the most affected states that it is no point solving the situation in Guinea without solving it in Liberia, or solving it in Sierra Leone without solving it in Guinea. It is a regional response in terms of the most affected states, but it's also, as has been outlined by the Assembly and also in the Security Council, a global effort. As the ambassadors of the primarily affected states, we make ourselves available for all briefings, all questions and clarifications of the situations on the ground. But as we see that even with the best of planning and the best of hopes, we can still not be able to anticipate the unexpected. We had expected to hear, of course, from our key operators on the ground, but unfortunately, due to communications problem, we have not been able to get through to them. As the effort intensifies on the ground, we hope that the sense of hope that UNMIR wishes to communicate and the international community wish to communicate to the afflicted will actually be achieved. With your help, Mr. President, we will remain focused, we will remain engaged, but most of all, we should remain fully charged to reinforce whatever efforts we've made and also seek to see what further efforts we can make as an assembly and also as the United Nations. It is quite simple, a situation of dealing with the Ebola virus in the epicenter of West Africa before it gets to the major cities of the world. And that requires a collective, intensified, and fully engaged attention. Mr. President, as we look at the response, we also must look at the consequences for those who survive. Women who have survived and children who have survived face a grim future in that the head of the household, the key provider of funds for that household, may have passed away. Orphans may have lost parents, and they look forward to a bleak future. As we commiserate with those who have passed away, let us make sure that we strengthen and enhance the chances for a better and a post-Ebola life, a more dignified post-Ebola life for those who have survived. Mr. President, there is perhaps, for some, reading the news, particularly the news media in the West, to feel a sense of despair. But we, in the most affected states, do not feel this sense of despair. We are committed to the fight, and we ask for all of our colleagues, all friendly states, and all member states to help us in this fight. The medical experts tell us that Ebola can be defeated. The protocols, the procedures are in place, and we are hopeful that a vaccination, better testing procedures will come down the line to make sure that we can anticipate isolate and eradicate Ebola as soon as possible. We're grateful for the promising clinical trials that are ongoing, and we realize that by the end of November and December, several institutes or states might be able to give positive news about these clinical trials. We're also grateful for the diaspora, our respective diaspora populations, who continue to raise funds and remain our key advocates in spreading the message that the region should not be isolated. I support the call of my colleague that isolating countries is not the way to go. And as we have seen, the very lack of specificity of some of these bans has resulted in Nigeria and Senegal, who have been declared Ebola-free, also being captured in the net of isolation and also visa bans. We are grateful that ICAO has submitted a project to the Multi-Partner Trust Fund to train and also sensitize civil aviation authorities in the affected states and also liaise with the airlines to make sure that the message goes out about the measures, the health measures that have been taken at our airports to make sure that travelers and passengers are safe. We continue to be grateful to Ghana for the air bridge, the essential air bridge, and also for hosting the mission headquarters. And we hope that the Ebola crisis managers will receive the support that they need to do their work. Mr. President, we believe that there will come a time when we'll have cause to celebrate. But that time is not now. There will become a time where we'll have to audit our individual and collective actions, but this is not the time. We still remain in the emergency phase, but we also have to look at the short term, the medium term, and the long term, because Ebola, as an event, as a disease, has tested all of us. But if we have to remember one thing, we who are in the position of relative safety must make sure those who are on the front line receive our support, our respect, in a way that enhances their basic dignity. I thank you, Mr. President.
I thank the distinguished representative of Sierra Leone for his statement.